Medical gloves are disposable gloves used during procedures to protect both the patient and the nurse from infectious diseases, blood, and other bodily fluids. Enforcing and regulating gloves and other protective equipment is a form of safe practice that affects everyone in the hospital. Without the proper use or removal of protective equipment, it can both put the healthcare provider and the patients at higher risk for infection. By wearing gloves and protective equipment, the aim is to prevent transmission of infections from the patients to the healthcare providers, and vice versa.
Like all complex adaptive systems in the hospital setting, there are policies and standards of practice that are in place regarding gloves. With fuzzy boundaries, however, it is hard to ensure that every healthcare provider is doing proper hand hygiene and using gloves appropriately. There is a sense of trust in nurses to do procedures correctly and in the correct manner, as not everything is monitored or regulated.
Throughout the U.S., there are different standards of care. However, wearing gloves is always an imperative safety precaution. Gloves are most effective when worn and disposed of properly. Unfortunately, there are numerous problems that can arise when putting them on. Gloves can easily rip or tear, which then exposes both the patient and the healthcare providers to possible infections. When nurses wear jewelry, such as high-profile rings or have long nails, the risk factors increase, just as a needle stick would if it were to rip or tear their gloves.
This is a problem in the healthcare setting because nurses will not wear gloves when exposed to bodily fluids, like changing a baby's diaper, because they have not assessed the situation properly. The nurses have the possibility of exposing themselves to another person's bodily fluids and therefore should wear gloves. In addition, nurses will take off gloves improperly, which exposes them to whatever bodily fluid, blood, mucous membrane, excretion, secretion, or other organisms that are on the gloves.
So for the purpose of this demonstration, we know that us nurses would generally take off our gloves if they were visibly soiled. However, we just want to show an exaggerated version to what would happen if we didn't. Nurses should wear gloves when exposed to blood, bodily fluids, secretions, excretions, mucous membranes, and non-intact skin, like in wounds. If you are doing different procedures on the same patient where gloves have been in contact with possible infectious organisms, the nurse should change gloves. Nurses should remove their gloves after use and before touching the door handle, sink, or other non-contaminated items and surfaces, or going into other patients' room. This can lower the risk for spreading infections.
According to the World Health Organization, wearing gloves does not provide complete protection against the person's hand being contaminated, which is why it's important to use proper hand hygiene after glove removal.
Ultimately, the hospital is the largest stakeholder. They hold the largest vested interest in the well-being of their staff. The primary purpose of gloves is to protect the person who is wearing them. Nurses are the other stakeholder because it's their health and their practice they're putting at risk through improper use and disposal of gloves. By improving the use and disposal of gloves, nurses can help prevent the nurses and other staff from getting ill. Everyone can benefit from properly protecting ourselves and our patients. Studies have shown that double gloving in high-risk situations can be beneficial to both our patients and ourselves. One study said that glove perforation was detected in 10 out of 112 sets of single gloves and 12 out of 106 sets of outer gloves in the double-gloved group. There was no inner double glove perforation. Glove perforations were found in 6 and 4 of the 112 sets of single gloves for the first assistants and the scrub nurses, and 5 and 7 of 106 sets of outer gloves in the double-gloved group for the first assistants and scrub nurses, respectively. The average occurrence of perforation was 69.8 minutes, and the beginning of surgery. The site of perforation was localized mostly on the left middle finger and the left ring finger. Some advantages to this solution is that it decreases the chances of spreading disease and infection through glove permeability to the person who's wearing the gloves, and it protects yourself from greater personal protection. Unfortunately, some problems are it doesn't directly address proper use and disposal of the gloves, and it doesn't prevent transmission to another person or an object. More expensive to use for supplies is another downside.
Another potential solution is to increase the frequency and importance of education about glove techniques on the hospital floor. And so this could be implemented through a mentorship program within the nursing staff, and also just hold each other accountable for proper glove techniques. One online survey about nursing students showed that gloves were often worn inappropriately, and another focus group revealed that students conformed to whatever their mentor used gloves. And so this meant that if their mentor had good glove techniques, then the students also used good gloving practices. But if they had a poor practicing nurse, then they also picked up on the poor habits. So the student nurses' decisions to wear gloves kind of seem to be based more on a culture of clinical care environment rather than a trust policy. And glove overuse too can actually lead to a breakdown in therapeutic touch and can also lead to contact dermatitis in nurses. And so we think that all student nurses must be able to identify clinical situations when gloves are indicated and are not indicated and use an appropriate risk assessment. One good thing about this is that it would hold other nurses accountable and would create a community effort to change bad habits and practices. And this mentorship program would extend to reinforce good practice. It's cheap and it requires little additional time on the part of the hospital staff. However, it also relies on the participation of everyone as a whole, and the staff must actually buy into the importance of this training and see the value in it. And nurses have to know what good assessment is in order to know what the situation requires in terms of gloving.
Our final solution is to create a permanent education tool that can be placed in a common staff room with high visibility and provide training sessions with practical application and discussion at regular intervals, monthly, quarterly, etc. It is a responsibility of the nurse to take a hold of their education and continue to better their practice. Our final recommendation is to educate nurses and future nurses of the importance of proper gloving and removal of gloves. In order to evaluate this progression, the charge nurse should randomly assess 2 to 3 nurses each month by doing a rounding assessment. The goal would be to observe the nurse's techniques and practices and remediate where applicable. Ultimately, the aim is to decrease the amount of infections due to improper glove use. It's up to you and me to educate ourselves and others about this important thing. Do you have any glove stories where you wish you would have worn gloves, or maybe they ripped in a very dire situation, anything like that?
Yes, I definitely have one. I have several actually, but this one was the one that taught me to always wear gloves every time I went into a room where I was just helping out on another unit and the call light went off. So I wasn't familiar with the patient or what was going on with her. I walked in to go talk to her, didn't put on my gloves or anything, just to ask her what she needed. And at that point she said, "I'm going to throw up," and then boop, it came out a half a second later, and I was trying to help her with stuff, not having gloves, knowing that she was sick with I don't know what, and there was blood in the vomit. And so since then, it's just habit now that gloves come on immediately when I enter a patient's room.
And as nursing students, do you have any advice for us? Obviously, before that, you didn't know exactly. Like, we answer call outs all the time, so you still, even though maybe we're just getting water, you still think we should wear gloves?
Yeah, I do. Usually they have them right at the door, so I'll put them on as I go into the door, or I'll keep some in my pockets. So if I'm in a room and don't have them available to me close by, I have them right in my pockets to just slip them on real quickly.
Okay. And we also did some research, and some of it said that with therapeutic touch, they worry that if you wear gloves all the time, you're kind of like missing that with the patients. So how do you feel about that?
I don't think so, because there's the therapeutic touch, but there's also just the empathy that you give to patients when you are touching them. So if you put your hand on their shoulder or whatever, it's not always necessarily about the skin-to-skin contact, I don't feel, but it's also behind what's the heart behind what you're doing. How are you talking to them? How are you touching their shoulder? Is it, in a way where you seem kind of standoffish, or is it in a way where you're making yourself vulnerable so they feel safe talking to you?
Okay, great. Thank you so much. Thank you for watching our video.